welcome to these special editions of the Helplink Show. We are bringing them to you during the crisis so you can get a little bit more information and insights into how you can take care of your mental health and the mental health of those around you. So do apologise for the sound quality of these small podcasts that are going out. Unfortunately, they're being done online or from the studio that is now my house. So do apologise again for that. Please note also, I mentioned a couple of times throughout the podcasts about our low-cost counselling supports services still being open. We, since the time of recording, we have also developed a national and international community response to the COVID-19 crisis. What we are doing is we're providing free counselling online to those people who have been laid off because of the crisis, to people who have addictions, gambling, alcohol and or drugs, to people that are returning home to Ireland, so I suppose especially for the healthcare workers that are returning to help in the fight. We thank them very much for that. And our Irish Abroad free counselling service is still operating 7 days a week globally. So yeah, that's a few different things that we're doing there. We would very much appreciate it if you could donate to our COVID-19 response, where we provide all these free counselling services. You can go to our website and click on the donate button there, or you can go to Facebook, where we have a Facebook fundraiser going on. Very much appreciate anything that you can provide, small or big, to help us keep going with this initiative. So thank you once again for listening, and remember, please keep your head. So, welcome back to the Helplink Show. This is Lachlan here, and I have Teresa Burns on the line with me. Teresa is a counsellor with Helplink, and she's also has some extra training in dealing with bereavement and grief. She is on to talk to us today a little bit about that experience, and also then, I suppose, to maybe chat a little bit about how people can look after their mental health a bit during this very strange time where we're all isolated at home. Anyways, Teresa, thank you so much for coming on.
Thank you, Lachlan, for having me.
It's a pleasure. It's a pleasure. So, Teresa, tell me, you've had some experience yourself with grief, and is that what led you to an interest in supporting other people?
Yes, Lachlan. Yeah, my own grief journey started in 2001 when my late husband Michael died. At that time, I did get lots of support. As most people know, when a loved one dies, your whole world falls apart and you feel very alone on your grief journey.
Okay.
So in 2008, I attended bereavement support group training that was run by the Family Life Centre in Castlebar.
Okay.
This training was exceptional.
Right.
So following on that, in 2009, I joined the bereavement support team in the Family Life Centre in Castlebar, and I'm still part of that.
Okay.
Subsequently, I went back to college and trained to be a counsellor with ICAS in Limerick.
Yes.
So here I am, Lachlan.
Yeah, there you are. And so it took a personal tragedy for you to find the area that you really wanted to support people in.
Absolutely.
Yeah.
When I started the journey, I certainly didn't ever think I'd be here talking to you.
No, it's funny, isn't it?
My life was dull at the time and dark.
Yeah.
So out of bad comes good too.
You can do. I mean, with grief and with crisis, sometimes change can come and actually bring light back into your life, like you were saying there. We talked about this before, because you did some work for us as well for our Irish Abroad counselling service. So because there really there's lots of different types of grief. It's not just what everybody thinks of as death being the main type of grief. There's actually lots of different types of grief.
Of course.
Mm.
The grief can be, I think we're all grieving losses all our life.
Right.
You know, you could be grieving even from children moving from one school to another. There's a loss. There's a loss in that.
Yeah, lots
when
of
people
friends and things.
leave home, there's a loss in that, and especially when people move to other countries, as you said.
Yeah.
There's a huge loss. Although sometimes they won't be telling mommy or daddy,
Right.
or their friends. They're having a great time.
Of course.
We'd say in Australia.
Yeah.
That's what I found when I was working with them. There was a loneliness, there was a grief that goes with that.
Yeah.
And you know, as it's not good for your mental health, so it could lead on to some anxiety. So that's where the online was really, really helpful for lots of my clients at that time.
And also, I suppose right now, all the children and young people are away from their friends and their school routines, and parents and people that don't have kids, in fact, are away from a lot of them are away from their jobs and their normal daily routines, and that in itself is a form of loss. Yeah.
Absolutely. I find it very difficult doing this social isolating. So I really feel for children and teenagers. You know, they have to adapt to this change, and not fully realizing the huge fear and what is really happening. I think, and I really do think a lot of them are doing it. You know, a lot of them are doing it. I think they're great because, as I say, I'm finding it hard to adapt to the change. So while we give out about them, I think they're really doing really good as well.
Yeah.
And I just remember back when when the foot and mouth disease, I remember back, I wasn't as frightened as I actually am right now about it.
Right.
So you have to remember where children are at and teenagers, and I think they're doing really well.
Yeah.
With the difficult situation.
I do, and fair play, I have to say, to a lot of the parents out there as well, who are stepping up to the mark, and a lot of them are putting these routines in place as well. And really, that is one of the keys to reducing anxiety and the grief and loss and the stress of this, is for us all to have daily routines put in place. You mentioned before to me as well, when we were talking, that that can also be really important when it comes to bereavement. Making sure you establish your routines, like getting up in the morning and that kind of stuff. And
a routine, yes. Yeah. And again, I have to remember, people that are bereaved, they're that extra bit vulnerable. We're all vulnerable at the moment, but people that are recently bereaved and they're just trying to come to terms with their grief, and they've all this going on the other side of it.
Yeah.
You know, I really feel for them. But it's important for their mental health as well to get a small routine in place.
Yeah.
Like, or even 5 minutes walk. You know, not, just watch their diet, sleep, breathe in. You know, if they could do some breathing exercises, it is very, very difficult time. And, with grief at the beginning, the concentration won't be as good, so it's minding, washing the hands and trying to think of it. Like, there's a lot that is going on.
There's so much there, isn't there? Like, I feel
that it's just that bit difficult for them.
Right. And extra difficulty on top of it, of course. So you mentioned breathing there and mindfulness, and these are all like helpful videos for this kind of stuff, is all available on YouTube at the minute. Why is breathing so important?
Breathing?
Yeah.
Well, that's all we have, Lachlan, at the minute. We're alive once we're breathing.
Yes, true.
But sometimes we're just shallow breathing. We're not, we're not doing the deep breathing. So it's important to take the deep breaths in through the nose, down into the tummy, and out through the mouth. If it was only just counting to 5 in and counting to 7 out, that's going to calm your mind straight away.
Okay.
It's going to distract from all the fear and the panic that's going on at the moment.
Yes.
Just give you a moment. And if we can get a moment, it's moment by moment.
Yes. Yeah, yeah, moment by moment and day by day. Yeah, there is also there's a lot of misinformation and unhelpful information out there right now. So I suppose it's also making sure that you don't basically engross yourself with all this news on social media and that kind of stuff's going on. Only use reputable sources.
Yes. What I would say there, Lachlan, is just stick to the guidelines of the HSE. Keep informed. It's important. Maybe read it once a day. Keep informed, but don't dwell on it.
Right.
Because what dwelling on it creates fear, creates panic, which is not good for our immune system right now.
Okay.
Stress. What does stress do? It weakens our immune system. We need our immune system strong for now.
Okay. Right.
So that's what I would be suggesting is, keep informed, but don't dwell on it.
Okay.
It's so important to pick up the phone. We've loads of WhatsApp, video calls, texting, FaceTime. We have loads. The technology is brilliant,
Yes. Yeah. I mean, I have to say, if this had happened 10 years ago, I think we'd be in a lot sorrier place, and there would be a lot more mental health difficulties arising because of this situation. We have the ability now to talk to each other and to look at each other, which is really great. And
help each other using the technology.
Yes, that's key, because there's going to be a lot of people out there that wouldn't be that au fait with the technology. So if you can help them over the phone, get things set up and that kind of thing, that would be really good. And also, there's a lot of people out there that wouldn't have smartphones and laptops and PCs and that kind of stuff as well. And for those people, like, it's very important to pick up the phone and talk to them, or for themselves to pick up the phone and talk to others.
Yes.
Yeah.
And
writing. Yeah.
Get out in fresh air. To get out in the fresh air, in the back garden. Look, if you're having a back garden, you go to the beach, just for walks. Self-isolate, keep 2 meters apart, and it's to do something, something rather than sit and dwell and wallow in it.
Exactly. I mean, like for those that maybe might be in apartment blocks and that kind of stuff as well. If you can't get out into the forecourt for some reason, then you just open your window and try and get some fresh air in that way, and talk to a neighbour over a balcony or something like that. But once again, keeping the distancing. This is just very, very important to keep connected with people.
Absolutely. Yeah. And keep the exercise, keep motivated, and mindfulness. They're all it's the buzzword at the moment. And what is it? It's living in the present moment. That's all we have. The present moment. Come back to the moment, because when people talk and they talk negatively about it all, and the fake news, as you said earlier, that creates more.
Yeah, more anxiety on top of that.
When you go back, the mind goes back, so you have to come back to the moment, and it's all about mindfulness, keeping it in the day. We don't know what's going to happen, and that's the fear of the unknown. So, staying positive is the same as being negative right now, because we do not know what's ahead of us. Yeah,
it's a counterbalance. It's a counterbalance to the negative feelings and that kind of stuff. And there are, as Teresa mentioned, there's lots of videos, short videos on YouTube around mindfulness, just to get you started. Introductions and that kind of thing can be very good. And also, Teresa, you mentioned at one stage about eating well, eating healthily.
Yes. Be mindful. Be even doing mindfulness with that as well. Just be mindful of what we're eating.
Yeah.
Because for the bereaved, it's either you don't eat or you eat too much. And it's trying to get that balance right now, in order again to keep our mental health well.
Yeah, because your physical health obviously equates to your mental health as well. Thanks very much for all that, Teresa. Is there 3 things that you'd like to leave the people with who are listening?
Be kind and compassionate with yourself and others. I would say stay connected with family and friends. again by video calls, texting, phoning, FaceTime, and also to follow the HSE guidelines.
Right.
Stay safe, social distancing, and if you need help, there is online counselling there.
Yeah,
for
exactly.
or for whoever. It's not for everybody, but it is there. Just to know that it is there.
It is there, I suppose, and I suppose that part of that thing when you mentioned online counselling there, obviously that's what we're doing in Helplink right now, and have been doing for 7 years. Is that some people might be a little bit afraid of it, but if you've ever used WhatsApp or if you've ever Skyped anybody, it's very, very similar to that, and you can get a lot of support that way from your own home. If you're worried about being in your own home and you can't get a private space, you can go out to your car, you could go out to, if you're out in the country, you could go out to a shed or a barn, or we can even actually, and we have done this many, many times before, we've brought clients have put earphones in their ears and brought their phone with them and walked and gone for a walk and have had their counselling session while they're walking. There's just so many ways of getting support right now that we would say to people that, like, if you think you need that kind of extra independent support, give us a shout, go onto our website, or also if you feel like you're in crisis, the Samaritans phone numbers are still open. The Pieta House crisis numbers are still open, and there's lots of information there about that. Also, if you want to check out our social media sites, we have links there for useful numbers and to a few YouTube videos as well, as Teresa was talking about. Teresa, thank you so much. I really
Can I
appreciate
just say, Lachlan, before
Yeah, sure.
finish? We'll get through this together. And can I just say, hats off to the frontline people, and I mean that from the bottom of my heart. They're amazing people. They
really are. They really are. They're literally keeping our country going, and we thank them so much for that. And we thank people like yourself, Teresa, as well, who are supporting people with their mental health. I really appreciate that and your time today. Now, thank you, Teresa.
Thank you, Lachlan. Bye.
Okay, folks, so that was Teresa from Helplink, and she also is providing counselling services with us over this time and beyond. Thank you so much for listening, and keep your ear out for the next podcast. And remember, keep your head up.